Well, welcome everyone. Good afternoon. My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control, and I'm very pleased to welcome you to our monthly Innovations in Tobacco Control seminar series. So glad to have you here, and I'm delighted to introduce our guest today, Dr. David Ashley. So Dr. Ashley was trained as a chemist at Emory University. And he's currently a professor at Georgia State University School of Public Health. But the majority of his career was spent in public service in the US government, and he spent most of those years, over 25 years, at Centers for Disease Control and Prevention at the National Center for Environmental Health, and he was in the Environmental Health Laboratory. So he did there a lot of work and carried out extensive research on cigarette design and contents of tobacco products, their emissions, how people use tobacco products, and biomarkers of exposure. So he did that for many years. He did a lot of other things, not just tobacco, but that was sort of summarizes the types of work he did related to tobacco. And we heard yesterday that his first paper on tobacco was on a recall of Philip Morris cigarettes, where Philip Morris was concerned about very high levels of some volatile chemicals in their cigarettes. But he had done some work in that area. And following over 25 years at the Environmental Health Laboratory, he took on the job of the inaugural director of the Office of Science at the Food and Drug Administration Center for Tobacco Products. So the Center for Tobacco Products was formed in 2009 with the signing of the Smoking Prevention and Family Smoking Prevention Tobacco Control Act, or Tobacco Act, here in the United States. And David was really key in setting up and building the Office of Science in that center that's responsible for providing the scientific support for all the regulation and guidance that comes out of the Center for Tobacco Products. They also are responsible for reviewing tobacco product applications and carrying out their own research. So Dr. Ashley has a lot of experience in that regulatory science environment, and he's on a mission now to share with as many people as possible what type of research is really useful that the FDA can use to inform their decisions and how they move forward, and maybe what's not so useful. And I think, as academics, we're not necessarily trained in that way to be thinking about what changes can be made, how we can foster our work to really be useful in the regulatory process. So I'm really excited to hear his presentation on how our scientific research can inform the regulatory process, specifically related to tobacco control, but I'm sure if you have interests in other areas, it'd be relevant as well. So Dr. Ashley, thank you for being here.
Thank you, Joanna. As Joanna said, can you guys hear me okay? All right, good. As Joanna said, I spent 27 years at CDC in the Environmental Health Lab. My training is as a physical chemist. I went to CDC. I became an analytical chemist. I spent 27 years there. About 15 of those years were spent dealing with tobacco. The rest of it was dealing with environmental exposures and biomarkers of exposure. I spent 27 years there. I had the opportunity to go up to FDA and work at the Center for Tobacco Products, and that was a terrific opportunity for me. When I got there, we had 15 people on staff. When I left, we had 325. So a lot of it was hiring people, bringing them in place, putting the procedures and the processes and the policies in place for how to address this law that was written, the Family Smoking Prevention and Tobacco Control Act, and actually make it do what it was supposed to do. And so that was a huge challenge. One of the things and I left there in 2017. Yeah, 2017. And went back to Atlanta, and I'm now a research professor at Georgia State. One of the things I realized when I was leaving FDA is people that do research that will support the kind of work that FDA needs, the things that they need to actually make regulatory decisions, most people don't understand how to do that research. And the frustrating thing is FDA really can't tell them how to do that. FDA is pretty much a closed box, and so one of the things I decided is when I left FDA, I was going to take the opportunity to go out and talk to groups and try to explain to them how FDA works. The people at FDA love that I'm doing this. I actually was talking to Mitch Zeller about 3 weeks ago, and I mentioned I was doing this, and he was very glad I was doing this because they can't talk about it, but I can talk about it. So what you're going to see here is my viewpoint. It is not FDA viewpoint, but it is what I believe is very, very important. And the information I'm going to provide, it's not going to be comprehensive. There's no way I can cover everything in an hour. I've got some examples in here, mainly because if I just talk theory, it doesn't get to be real. And so I've created some examples, and don't take those examples as any indication that this is something FDA is thinking about doing. Matter of fact, I purposely thought of examples that I don't think FDA is going to do anytime soon. So I've got some examples. Don't take those the wrong way. So in 2009, the Family Smoking Prevention Tobacco Control Act was passed. It was signed by President Obama and put into place. That gave FDA regulatory authority over cigarettes, smokeless, roll your own tobacco, and cigarette tobacco. And that's where their authority laid at that point. And so the scope of those things. E-cigarettes were not even a thought at that time. And people that had no idea, even heard of these things. Cigars were excluded. There were some other products that were excluded, mainly because these were the products that were most concerned. But in 2016, FDA exerted authority over anything that fits the definition of a tobacco product. And the definition of a tobacco product is that anything is made or derived from tobacco and for human consumption. So everything fits under that umbrella now, including e-cigarettes, cigars, pipe tobacco, nicotine gels, nicotine water. Water pipes fit under that. Dissolvable tobacco that was not already under FDA's authority is also included, and any future tobacco products that someone comes up with also fits under that authority. So it really expanded FDA's authority to cover all of those, which raised some really huge issues because many of these products are really complex and they are varied. And trying to deal with just something like cigars, which go all the way from little bitty cigars to big old cigars, gets really complicated. How are you going to develop laws and regulations around all those products? But FDA felt like they had to exert authority over all of these, or what the companies had done in the past, which was redesign their products so they went to a category that was not covered, couldn't be done. So FDA did that. So the first thing I want to talk about is what is tobacco regulatory science, because that's what I'm going to be talking about this whole time. Tobacco regulatory science is different than regular science. Regular science is basically trying to take some things you learn and then develop generalized principles that explain those things you learn. So it's going from an experiment and the results in an experiment and then expanding that into a theory that hopefully will apply to other things. And that's generally the way science works. Regulatory science is basically the opposite of that. Regulatory science takes general theories and then applies them to specific situations. Just knowing that this particular class of products may do something is not effective for regulatory science. What you have to know is the specifics of that issue, and that's how those generalities are not effective when you have to actually make those regulatory decisions. So you take distinct situations and you look at whether that particular situation, what is its effect on public health, and make your decisions based on that. There are 4 primary ways that FDA exerts its authority over tobacco products. The first of that is product standards. Those are regulations that may apply to all brands and sub-brands. So that is more of a broad regulatory authority. The second one is product review, and those are marketing decisions that apply to specific brands and sub-brands. So these two things are very different. Product standards can apply broadly. You can apply it to all cigarettes, or you can apply it to all tobacco products, or you can apply it to, all cigarettes that have a certain property or something like that. But it's broad. Product review is very different. It is about a specific brand, a specific sub-brand, and you're making a decision on that. And I will go into detail on all this in just a few minutes. The third area that FDA does and it exerts its regulatory authority is over compliance and enforcement. And that is really enforcing the laws that are already on the books. And that seems pretty simple. To me, before I got to FDA, that seemed like a really simple thing to do. The law says something, people have to obey the law, right? It gets really much more complicated than that, because if you're going to go before a judge and prove to a judge that someone broke the law, there is a lot of science that's got to be done to support that decision. I had no earthly idea about this. It seemed pretty simple, but it's much more complicated. And then the fourth area to talk about is public education, and that's really helping the public know how they can protect their health. And public education is something in CTP that's done a lot. The other centers within within FDA do that some, but CTP has realized that dealing with tobacco, public education is a really, really important aspect of exerting that regulatory authority. So, I'm going to take you through tobacco regulatory research. And the best way to do that is to kind of step you through what the process is that I believe that you should follow. The first thing and the most important step here is to identify the specific rule, regulation, or action that what you're doing will actually support. And I mean write it down. Don't be vague. Don't just think, I'm going to try to reduce toxicity. That's not enough. You've got to be very, very specific. You might say something, and again, I'm going to give you an example here. So a good example would be, we're going to set a maximum allowable level of diacetyl in e-cigarette liquid that prevents any increase in the risk of respiratory disease. Now that's pretty specific, but that is a kind of thing that when FDA gets research on this issue, they can actually act and do this. So that's an example of what would be a product standard that FDA could put into place. Another example, demonstrate that increased levels of flue-cured tobacco in the blend increase product carcinogenicity. That could be a product review question, because if you get in a product that's got higher levels of flue-cured tobacco, you can say, no, you're not putting that product on the market because I have evidence that if you do that, it raises those levels. These, again, are very, very specific. A third one, remove a product from being marketed that claims to be additive-free. That's pointing toward a specific product. The law is that they can't make modified risk claims. Additive-free is a modified risk claim, but you need the research that supports that specific thing. And the fourth one, list amounts of constituents on the packaging of tobacco products in a way that's understandable and not misleading. And I'll talk about that one in a little bit and the challenges that go behind that. So these are very specific things. And so the first step is to write it out. Again, not just have some vague idea in your mind, but write it out specifically, because that will then guide how you do the research, how you design the research to answer those questions. So first, let me talk about product standards. Product standards are really a very, very powerful authority that was given to FDA as part of the Tobacco Control Act. And this is what the language is in Section 907. Through rulemaking, the Tobacco Control Act allows adoption of tobacco product standards, and the standard is appropriate for the protection of public health. Unfortunately, the law doesn't define what that means. It doesn't define what appropriate for the protection of public health means. And so FDA has to define that. And the way FDA actually does things, the way they put definitions out on things, is they usually make decisions. And every time they make a decision, it helps to refine a little bit what they mean. So you make a decision here, a decision there. Eventually, it becomes clear what those decisions are based on, and that becomes, in essence, the law, because that's how they're acting. And there are a number of things that are actually listed directly in the Act that fit under product standards. And those include nicotine yields, the reduction or elimination of constituents, including smoke constituents, construction, components, ingredients, provisions for testing, restrictions on sale and distribution, and then the form and content of labeling for the proper use of the tobacco product. So those are listed specifically. That's actually a pretty good range of stuff. If you're trying to change a tobacco product, you got a pretty good set of authorities to work with within that range. So the statutory question, as I said before, is will this product standard, is it appropriate for protection of public health? And it is defined a little bit. They give you a little bit more information. They kind of break it down some. And that public health includes the risks and benefits to the population as a whole, the increased or decreased likelihood that existing users of tobacco products will stop using products, and the increased or decreased likelihood that those who do not use tobacco products will start. Some of the things in the law are really bizarre, and it was really, really tough to figure out what Congress meant. This was a really smart way to do this, because almost all of FDA, the way they deal with their products, the way they regulate the products, is about the user. So if you've got a drug, they're concerned about people that use the product, whether it is safe and efficacious, whether it will do what it's supposed to do, and whether it's safe to take. And it's all about the user. They don't really care about anybody that's not using the product. That really doesn't matter. It's a completely different ballgame with tobacco. With tobacco, you're not only concerned about the people that use the product, you're actually concerned about the people who don't use the product because they may start using the product. And so you've got that whole group. And then you're also concerned about people that are going to stop using the product. So Congress was really good in this aspect that they included that as part of that definition of appropriate protection of public health. Really important to know that as far as product standards are concerned, the evidentiary burden is on FDA. FDA has to prove that this is appropriate protection of public health. The companies do not have to prove it. FDA has that burden. So science is directed really strongly. And when you're beginning to put together the science around a product standard, you've got to think about all those aspects. And I'll go into that in a minute and explain that. There's a couple other things that were thrown in there which are kind of bizarre. You must consider technical achievability, but the word they use is consider. It doesn't say something has to be technically achievable to be a product standard. You can actually pass a product standard that's not technically achievable. It just says you have to consider it. Now, you're going to have to get it through the courts once you get sued about it, but it's just got to consider technical achievability. You got to talk about it when you're doing the act. The other, you've got to consider countervailing effects, things like black market. So if you do something to the product and that increases the black market, you've got to consider that. It doesn't say it stops it, but you've got to think about it, you've got to address it, you've got to talk about it as you're writing that law. So those are things that have to be considered as you go along. There's several decision points you make as you're putting together a product standard. And again, FDA's got to have convincing evidence that the product standard is appropriate protection of public health. They've got to be able to prove it, and not just prove it to themselves. They've got to be able to prove it to the public, and eventually they're going to have to prove it to a judge. Virtually anything FDA does gets, there's a lawsuit. They can't, wake up in the morning without a lawsuit. And so you have to address that. And matter of fact, the entire time you're putting together a product standard, you're thinking, what's their lawsuit going to be? How are they going to sue us on this? Because you know they're going to sue us. And so to answer those questions, you've got to be prepared for that lawsuit. You've also got to enforce that law. So to enforce the law, you've got to be able to answer the question, does a specific marketed product meet the standard? You've got to be able to say, this product A meets the standard or does not meet the standard. So there's several things you have to put in place to do that. Number one, it's got to be justifiable. Is there adequate evidence that that law is appropriate for the protection of public health? It's got to be necessary. Is this the least costly alternative to achieving the goal? It's got to be appropriate. Will it do what it claims to do? It's got to be unambiguous. Is the requirement clear? Because if it's ambiguous, then you can't really enforce it. Is it measurable? Are there methods in place to measure it? And then is it quantifiable? Can you quantify exactly what you're trying to measure so that you can show to a judge this product met it, this product did not meet that? And so there's a lot of things. And most people really think, at least this is what, well, I can't say that. This is what I thought before I went to FDA. There's really two pieces of information you have to have a product standard. The first one is you have to have evidence for an adverse impact, and second, evidence to link whatever you want to change to that adverse impact. And that seems pretty straightforward. And before I went to FDA, that's what I thought. That's all you really needed was evidence that there's a problem and evidence that what you want to change is linked to that problem. But there is a lot more to it that I found after I went to FDA, including, the list got longer, didn't it? Including evidence that the proposed requirement would stop the problem. It's not enough to say there's an association, but you've got to say, we're going to put a standard in place and that's going to have an effect. Which are two different questions. They're really not the same as there's a link, but if I change this, will this change also? The viability of technical means of meeting the requirement, showing you've got to investigate whether it's viable to meet the requirement. You've got to look at the quantitative estimate of the public health benefit. It's not enough just to say, this is going to help public health. You've actually got to go in and quantify it. You've got to give a number about the number of lives saved, the number of cancer cases prevented. You've got to be quantitative because that's whole part of the process. Eventually, you're going to end up with a regulatory impact analysis that says exactly what is going to happen, what you predict is going to happen. Costs associated with meeting the requirement. What is it going to take for the industry that's trying to meet this requirement to do that? And you better come up with that information because if you don't, they're going to. And they're going to say the cost is astronomical and there's no way that this is a viable thing to do. Prediction of the quantitative impact of other related changes that may limit the benefit. So what other things may happen that prevent this thing from actually accomplishing what you hope to accomplish? Alternative ways which were considered to address the adverse impact along with estimated benefit and costs. And this is where most academic researchers fail. They think, I heard everything else, and so I got with a thing that I think will be the solution, and this is the one thing I have, and this is what I'm going to test. The problem is, when you get to writing the law, the first question that comes from OMB, Office of Management and Budget, is, what other things did you test to prove that what you're suggesting is the best? And if the answer is nothing, they say, go back and start over at ground zero again and come back to us 10 years from now and propose that again. So when you're doing the research, the most effective thing is to look at other alternatives. And I've got an example I'll give in just a minute of how to do that. At least I think I've got that example in here. If I don't, I'll get to it. Possible unintended secondary consequences of the requirement. So you're going to put something in place. What are the things that it might cause that you don't even know about? That's really kind of sitting around in a room going, what else do you think this is going to do? What's going to happen when we do this? Because you've got to identify those things, because when you write that regulation, the first thing that's going to happen is everybody in the world is going to come up with things that you didn't think of. And you're going to go, oh man, what am I going to do now? And you're going to have to go out and write guidance after guidance after guidance. One of the interesting things is if you see the deeming regulation that went out back in 2016, then look at all the guidances that went out after that. Those were all things that FDA thought they had thought of and they didn't think of. And those bizarre things came in, things we just did not anticipate at all. But you've got to try to think of as many of as you can. Then demonstration that this rule is within the bounds of what could legally be interpreted to be allowed by law. There are laws that restrict what FDA can do. One of them that's a real tough one to get over is, would putting this product standard in place be a ban on a particular class of products? And so you've got to be able to prove that this is not a ban on tobacco products. You'll find it very interesting when if you ever listen to Mitch Zeller, and when he talks, particularly when he talks about reduced nicotine, he doesn't say we're going to make cigarettes not addictive. Because that language can easily be used to say that that constitutes a ban on cigarettes. He will use the term, we're going to make cigarettes minimally addictive. And there is thought behind that. That's just not random words. There's thought, a legal reason he's using the words he's using, because otherwise the industry is going to come back and say, you said that these are no longer addictive, they're no longer cigarettes, you're banning cigarettes, throw the law out. So you have to think about what the law requires and make sure that what you're doing fits within the standards of the law. Okay, I'm going to give you an example. And I'm not going to cover all those issues, but I do want to give an example so it becomes more real and is not as vague as what I threw up on the board. And so let me give you a background first. I don't know if all of you are aware of this, but if you're not aware of this, it's a little background. So the difference between a full flavor, a light, and an ultralight cigarette primarily is these little things. Those are called ventilation holes. So a full flavor cigarette has very few ventilation holes. A light cigarette has more. An ultralight cigarette has a bunch of them, multiple rows of these. And what happens is when this device is put on a smoking machine, air goes in through these holes, it dilutes the smoke, and the machine measures lower levels. Very ingenious. When smokers smoke it, often they block those ventilation holes, and so they get the same levels no matter whether it's full flavor, light, or ultralight. So that's the basics of this. So that's basically what happens. The product was designed specifically to beat the machine, and it does a great job of beating the machine. When I was at CDC, we had about 5 or 6 smoking machines, and they all measure really low levels unless you block these ventilation holes, which is what smokers do. So the standard I want to develop is related to these ventilation holes. How do I address that problem? So, as I was saying before, air goes in through here. Most of the airflow goes down, but it gets diluted because of the air that goes in through those ventilation holes. So, here's my product standard that I'm going to propose. The product standard is reduce the ventilation to a maximum level of 5%. In some products, it's up to 50, 60% ventilation. To reduce it down to 5% in all cigarettes so that those who experiment will be less likely to progress to regular smoking. One aspect about these ventilation holes, in addition to beating the machine, is it's easier for kids to start smoking because the smoke is not as irritating. So you can start smoking, and then as you get more used to the irritation, you can begin covering up those holes, and you can graduate to more and more exposure. So the idea is, what we're going to do is we're going to ban these holes so that kids have a harder time getting started on cigarettes. That's the premise here. So what am I going to need? I'm going to need some evidence. I'm going to need to pull together some studies that support this activity. So here's an example of one study. So when ventilation is no higher than 5%, the research question is, what fraction of naive or new smokers who experiment with these products would not become regular smokers compared to experimentation with products where ventilation is different than 5%? Okay, so what we're going to do, is see whether people who start on these products become regular smokers. Now, this experiment is probably will never get through the IRB because you're talking about taking naive smokers and giving them cigarettes and see if they become addicted. Probably not going to work, but you're going to have to look at this question in some way. And one way to look at that question is not to do a random control trial where you're giving them cigarettes, but to actually do an observational study to find out what people started with and find out if they became regular smokers or if they quit the study. So this is a very good experiment. It would be very valid and will add a lot of information to supporting this product standard that we've got. Here's another one. What would be the quantitative impact if manufacturers increase paper porosity to offset the reduction in ventilation? One of the things they can do is, instead of using ventilation holes, they can actually make the paper more porous so air goes in through the paper. And that would thwart what you're trying to do. It'd still make that product less irritating. And kids would still get started on that product much easier. So how do you stop that? And so the experiment would be related to that, trying to address whether the companies might make that paper more porous and just get around your standard and beat the standard. And so you need to do those kind of experiments also. Another example, what would be the quantitative impact on the benefit if the standard was 2% or 10%? Eventually, you're going to have to go in there and show that 5% was the right thing to choose. And because OMB is going to ask you, did you try 10%? Did you try 2%? And if the answer is no, then you have to go back and do those experiments. And a whole lot easier to do it while you're doing it than to have to go back and redo it. So you need to look at alternatives. What are other things that might actually have this? And hopefully what you're proposing is right in the middle and it's the best thing to do. So that's a really good experiment to add into that question. And then looking at unintended or secondary consequences. Again, this is a really hard thing to do because you're basically trying to predict the future. And consumers and tobacco companies both are really innovative. They come up with all kinds of stuff that there is no way you anticipated. So how much higher exposures would smokers get if they changed the way they smoke the cigarette, smoking topography? How much would nicotine delivery dependence change with lower ventilation? So would people become addicted more or less? Then what fraction of cigarette smokers would switch to ventilated small cigars? Would they just switch to something else? Because if the last one is true, you're going to have to deal with the ventilated small cigars too. Ignoring them just means the problem is just passed on to something else. So you need to think about these secondary consequences and how to address those. These are all valid, important questions to go through. Okay, I'm going to leave product standards. I'm going to go to product review. Product review, again, if you remember, is looking at individual products and making authorization decisions about whether that specific product can go on the market. So product review includes investigational tobacco products. Those are products that people want to do research on. New product review, substantial equivalence, exemption from substantial equivalence, and modified risk tobacco products. It is very interesting because in this case, the applicant must provide adequate evidence for FDA to make a finding. For this, the evidentiary burden is on the applicant. Much easier for FDA to enforce this because the companies have to produce it. All FDA has to say is, you didn't give us enough data, you're out of here. With product standards, FDA has to prove that they provided enough data. So wherever we can push things towards product review, that's the right way to go. That's one of the reasons why, in relation to e-cigarettes, the companies are pushing FDA to say, we'll put product standards in place instead in place of product review. For product review, FDA can make a good, quick decision about e-cigarettes and get the bad ones off the market. For product standards, they're going to have to provide all this evidence, and we're not going to be able to deal with e-cigarettes because of that. So that's why when you hear that, and it makes sense. Why doesn't FDA put product standards in place? Sure, that sounds great, but that means now the burden is on FDA, whereas right now the burden is on the industry. And then FDA uses scientific research to evaluate the evidence that's provided by the applicant. So we have 325 people, actually have more than that now in the Office of Science, who review all of this information. And they spend tremendous amount of efforts on it. And it goes through multiple cycles. Usually we get a review in and we go through 4 or 5 cycles. That's before the lawsuit. And then after the lawsuit, we have more cycles we have to do. One of the things that people don't know, and it's sad to me that FDA doesn't talk about this. And I don't know what's happened since then, but when I left in May of 2017, this was true. At that time, FDA had removed from the market or prevented from being marketed over 2,500 new tobacco products. I've heard people say, and this really ticks me off a little bit, FDA's got this authority under the Tobacco Control Act and they've done nothing with it. I hear people say that all the time, and that really ticks me off because FDA has prevented there's probably, the number here is, I'm surely much higher than it was then, because it's been a year and a half. But at that time, 2,500 products that would have gone onto the market have been prevented from going on the market or have been taken off the market. I asked Mitch, why don't we talk about this more? And his concern is about congressional response to this. If we see FDA's really doing their job, the folks in Congress may not like it. And so, but people need to be aware of the work because, to tell you the truth, we spent hours. I can't tell you, because I reviewed every single one of these. Every single one went through me and had my signature on it when it went through. And that was a tremendous amount of work by a lot of very heavily dedicated people. So you understand a little bit about what those different things are. So you've got PMTA, which is new product review. And the question that's asked there is the marketing of a new product, again, appropriate for the protection of public health. We're back to that standard, very good standard, and that's the use. So a new product has to prove that they're appropriate for the protection of public health before they go on the market. You've got substantial equivalence. The question there is, do differences between a new product and a predicate product raise different questions of public health? Predicate product is something that's already on the market. When the tobacco industry agreed to allow the Tobacco Control Act to go into place, their understanding was that pretty much anything that looked like a cigarette would be on the market and be passed on. It would be no problem. They could continue to put new products on the market using substantial equivalents. It'd be no big deal. When we started thinking about this issue in the early days of this Center for Tobacco Products, we came to the conclusion that putting a product that's just a little more toxic or just a little more addictive is not okay. And so we decided that we would hold this to be a high standard. We did not make many people happy with that. They were really, really ticked off at us because that's not the way they understand the law was supposed to work. Their understanding was anything that looked like a cigarette we were just going to say, yep, okay. We didn't. We required them to provide data. We required them to actually prove that those products were not going to harm public health. And if they didn't, at least 2,500 times, if they didn't, those products were coming off the market. Then you've got modified risk tobacco products. The question there is, will the product as it is actually used by consumers significantly reduce the harm and risk of tobacco-related disease to individual tobacco users and benefit the health of the population as a whole? If you have the opportunity to watch a TPSAC meeting where the companies have come in and they're presenting their evidence to FDA, what I want you to do is listen for what I've underlined right there, as it is actually used by consumers. That is the key statement in this evaluation. Because the companies will come in, and I just saw one. We just saw one just a couple of weeks ago where they were talking about Camel Snus. Before that, when PMI brought in their IQOS, what they will talk about, they will say, if consumers completely switch to this product and use this product by itself, then they will get all these health benefits. And then they kind of, behind their back, talk about the data on actual use, or they talk about no data on actual use, which says that no smoker actually completely switches. They'll say 95% of smokers use these things together. And when you actually look at that data, you find out there is no health benefit. And so the phrase is, it's actually used by consumers. It's not as used by someone's imagination. So you have to go out and actually do a study to find out how will consumers actually use this product, and then what is the health benefit then. So if you get the chance to watch one of those presentations, keep this in mind, think about it, and try to pick up on the differences between what the company has presented and what FDA really needs to evaluate. Okay, when we begin looking at all product review considerations, there's one thing we're really interested in. Well, two things. We're interested in morbidity and mortality. What will happen if that product is introduced, or that product makes claims, or that product gets an SC decision? What is morbidity and mortality? What we actually get, the information that actually comes, and I have to apologize, I still do this. I still say we a lot. Sometimes I still feel like I'm back there. Every time I give this talk, I have a hard time saying FDA says FDA. I just say we, so just ignore that. It's actually, I'm talking about FDA because I'm not there anymore. But what we get, does it every time. What FDA gets is they get materials, ingredients, design, composition, constituents, other features, and marketing. That's what they get. And somehow this has to be translated into that. The way it's translated is through this. You look at product appeal, addictiveness, behavior and use, exposure, pharmacokinetics, toxicity, perception, initiation, and cessation. These are the studies, these are the measurements that translate the information that comes related to a product into morbidity and mortality. And so when you're thinking about research, this is where you want to be doing your research. You want to be looking at whether a change in design feature of a cigarette affects exposure and whether that will lead to more morbidity. That connection is what FDA needs. They need the connection between those three things because that provides them the rationale to tell a company, sorry, this is not going on the market. Product review questions. So I've thrown up a question here. And a good research question is, does added ammonia alter free nicotine levels in smoke as measured by machine smoking? That's a good research question. It's not really a very good research question. It's an okay research question. A better research question is, does an increase in ammonia of 50% in smoke increase free nicotine smoke delivered to smokers? First thing is, I want this to be quantitative. I just can't say in general adding ammonia. I've got to be quantitative. So I'm talking about now 50% of an increase. So I'm getting to get quantitative. That's a little bit better. So that's a better research question. An even better research question is, does an increase in ammonia from 2 to 3 milligrams per cigarette in Colorado cigarettes change free nicotine levels enough to alter the rate of increase of nicotine blood levels in usual brand smokers? Now I've become much more specific. I'm quantitative, and I've actually identified the product. This is product review, this is not product standards. Again, product standards you can apply to lots of different things. Product review is around a particular product. And you may not be able to do this, but because the specific cigarette may be troublesome, but FDA has to make this decision. So the more specific you can get, the more you can narrow that down. Instead of just saying cigarettes in general, but narrow that down to particular properties or characteristics, that makes it much better. So this is an even better research question. Really, the best research question involves quantitative measures, it involves a product and health-related outcomes. So, does an increase in ammonia from 2 to 3 milligrams per cigarette in Colorado cigarettes change free nicotine levels enough to alter the rate of increase in nicotine blood levels in usual brand smokers and result in lower cessation success? So this includes all of those aspects in there, which will make a much better research question that FDA can use better. Now, go ahead, switch from review. I'm going to talk about compliance and enforcement. Woo, goodness me, the time's gone by. FDA is responsible for implementing and enforcing the provisions of the Tobacco Control Act that restrict. So FDA monitors for industry compliance through surveillance, inspections, investigations. So the compliance group is the people that go out and make the law real. Research for data that supports compliance are stronger if they're more specific to a case, but if generalized research can support that, generalized research can help support that, but in reality, when you're enforcing something, it's going to be related to that particular case. Here's an example, modified risk claims. How many modified risk claims do you see? Okay, I want a show of hands here. How many see 1? Okay. How many see 2? Not seeing many hands out there. They're too reticent. How many see 3? All right, I'm just not getting any hands. Come on, you can respond. I can see at least 3, maybe 4. There may be 4 modified risk claims in here. For example, no additives. That's an easy call. No additives is a modified risk claim. 100% tobacco. That may be a modified risk claim also. No bull may very well be a modified risk claim. True taste may very well be a modified risk claim. It's kind of hard to tell. There's at least 3, maybe 4 modified risk claims on here. What gets complicated is when people do research and they take all of these things off and show that people now have a higher harm perception of this product than before. Great, that's actually a really good study, but immediately after FDA tells the company to take all those off, they say, well, what if we just leave 1 on there? All right, what's the situation you're in as soon as they do that? The situation is you now have to have research to tell them whether they can leave that 1 on there. And then they'll say, well, what if we leave 2 on there? So the research has got to look at every possible combination here, because the company's going to come back with a suggestion of this is how we're going to fix the problem, and unless there's scientific research to say, no, that's not going to work, you can't tell them no. So invariably in these cases, you run into all those situations. This is a great enforcement success, and other people may argue and say this is not such a great thing. This was one of the most amazing things I saw at FDA, and it's a little thing. So this is an ad that I actually took off the internet. Yep, I took this one off the internet because it no longer exists. But this is talking about natural American spirit, and I've blown it up here a little bit. It says 100% additive-free natural tobacco. That's a modified risk claim. So FDA went after these guys. They said, you've got to take that off. You can't have this. And we did years of research, actually years of research to support this action. And this is what I took actually out of the back of a magazine. And I'm going to blow that one up too. And what it now says down here is tobacco ingredients, tobacco, and water. It no longer says 100% additive free. Some of the folks actually in the Office of Science argued that this is probably a modified risk claim too. And it probably is. But sometimes you just take your victories and walk away, because we had to figure out how far to push this, because if you push them too far, you're going to end up in court. And once you end up in a judge, you don't know which judge you're going to get, and you don't know whether he hates regulation and loves industry or if he hates industry and loves public health. You just don't know. It's a gamble. So we decided the industry was willing to accept this change, and we were going to take our victory and be happy with it. And so we left this on there, even though a lot of people argued. People have had a lot of respect for, argued within the office and said that's not good enough, but that was a victory. We talk about public education. So FDA and CDC have gone after different audiences. CDC's got their TIPS campaign, great campaign, directed at smokers to try to help convince smokers to stop. FDA decided that they didn't want to go after the same group of people. So they decided they'd go after at-risk youth and try to have a campaign directed to try to stop kids from starting to use tobacco products. They've had a series of those, which have been incredibly effective. And working from a science standpoint on those, it's just been amazing to work with communications people, have tremendous number of fights with them, completely disagree, but come up with campaigns that the Office of Science said, this is scientifically valid. And the communications people said, this will have an impact, which that usually doesn't work. You can't get those two sides to agree to those kind of things. Another thing we've run into is there's a requirement in the law to actually display potentially harmful constituents on to the public. And that is a really tough thing to do because people misunderstand it. But it says it's got to be understandable and not misleading to a layperson. Very hard to put numbers out to lay people and have them not misunderstand it. Particularly because the industry has used this in the past. And these are just ads from the past where they have talked about tar and reductions of tar and used that as a selling point for cigarettes. And they've even used U.S. government figures, the U.S. government. They used the fact that the U.S. government was making these things to help sell more cigarettes. And so we basically have come to the conclusion, like Canada did, that putting these numbers on the pack just will not work. Canada originally tried putting the numbers on the pack, but they eventually realized that the values were not clearly understood by some smokers. Most have little idea what the range of numbers displayed for each chemical means. People just don't understand what those numbers mean. So FDA has not acted on this, even though it's required by the law. Fortunately, the tobacco industry doesn't want us to put those numbers on the pack either. And so nobody is clamoring for FDA to do that. So this is what Canada does now. They just say tobacco smoke contains benzene, a chemical that causes cancer. They took the numbers off, which was a very smart idea. But there's several, and I'm going to jump through this so we can get some questions. There are a lot of different ways that communication can be benefited by research, and those included really trying to make sure that people understand what those communications mean, and then making sure that it is targeting the groups you want to target so that people will truly understand that. The science of tobacco regulation includes work around the product, chemistry, engineering, microbiology. It includes working about the tobacco product user, toxicology, pharmacology, clinical medicine, addiction, product use behavior, and work around the population as a whole. Environmental assessment, epidemiology, consumer perception, statistical analysis, and evaluation. So it is the product, the user, and the population. In summary, when designing and carrying out studies, write out the regulatory action that the research will be formed. Don't just think about it, write it out. Be as specific as possible about the characteristics of the product, the population of users that are included, and the impact on population health. Be quantitative, determine both costs and benefits, and then evaluate alternatives while you're doing the research, not after OMB tells you to go back and start over again. I'll be glad to answer questions.
Thank you so much, Doctor. My name is Ryan. My question is, sometimes when we are conducting like the tobacco control research, especially policy research, we also sometimes have this notion of battling the giants, especially in terms of counterfeiting the industry. Because sometimes in the market where in the country when the market of tobacco industry is big enough and they have some kind of like grip to the decision making Do you take account that fact when you're trying to come up with like research questions in terms of informing regulation regulation, and if yes, then how?
Okay, so what I talked about was the U.S. authority. So this is all based on the authority of the United States. We're the only country that has this authority. Other countries have different authorities. And what you've got to do is think about the authorities they have and how they can use their authorities. You can't make up stuff for them. You've got to think about what their authority is and how the research can benefit them under their particular regulatory scheme. And so you're exactly right. From country to country, as you're looking at what they need, it is a completely different matter. One of the real dangers is, and I have to prevent this as much as I can, certain countries will adopt things that another country has done thinking it's going to be effective, and they may not have that authority. Ran into that problem when Chile decided to adopt Brazil's law on additives, and Chile ran into all kinds of trouble. Now Brazil's run into trouble too. But you've got to make sure that the research you're doing and what the regulation is you're trying to put in place is within that country's legal authority. That's one of the things I had in my list down there. That is really one of the things you've got to account for and make sure it fits within. So yes, exactly. Now I was told that you guys would ask lots of questions. And so I'm holding you to that. We're going to lock the doors and not let anybody else till I get some good questions.
Thank you for this excellent talk. It gave me a lot of new perspective into the process, how FDA actually, what kind of research FDA needs, so very informative. My question is related to the example you had for the perforated filters. And then if you enact a requirement for the industry to change that they might then, as a response, also change the paper.
Right.
And so I was curious how, because this relates to cigarettes, right? So there's product standards in place for cigarettes. How much leeway do they have to just change another feature of a cigarette? Like, I guess I'm wondering how tightly regulated the different features and components of a cigarette are. Can they just change like whatever they want tomorrow if they think so?
Fortunately, in the U.S., no, they cannot. Any change to a product has to go through FDA, and FDA has to determine whether it meets the standard. And in actuality, if FDA put a standard in place about reducing the ventilation holes, and they went and changed paper porosity, FDA would go, you're out of here. But you actually have to know that that's going to be a problem. And so research that supports that, because the companies are going to come in and say, we're just doing this, change the porosity, and it doesn't have an effect at all. You need research that actually supports the fact. So the idea is to anticipate what the industry might do the research beforehand so that FDA has got a stronger set of evidence to say, no, that's unacceptable. That was a pretty easy one to call. There's a lot of other changes that are much harder. And so the more research that supports that, the better you are even in making product review decisions. But no, they can't just do that willy-nilly. They can't do that now. They have to come through FDA for every change to the product that they make.
The ventilation example you gave was great to step us through. Your time at FDA, you really focused on some big issues, and the country was grappling with some tobacco control issues related to menthol and nicotine levels. And I wondered, just given the gravity of those and the importance of the potential public health benefits, if you could touch on your perspectives and what you learned in the process while you were working on those issues at FDA.
Okay, this is my opinion. This is not FDA's opinion, so I want to clarify, be very clear on that. I do not know where FDA is with this right now, but this is my opinion. So there were several things that were immediately proposed that we do when the FDA got authority and after I got there. Menthol and nicotine were two of them. I actually went to FDA. My main reason to go to FDA was to try to reduce nicotine in tobacco products. I saw that as clearly a huge thing to do. Had to balance two things. One was what was the level of research? How much evidence did we have that would support it? And secondly, what was going to be the impact? How big was that impact going to be? And those were the first two things I had in my list, in addition to all those other things. So we set out very early to start doing research in both those areas. We had a TIPSAC meeting around menthol. We did a lot of work. I took my folks in the Office of Science and I gave them an assignment of looking particularly at the menthol question itself, and to evaluate whether we had the science to actually accomplish what we wanted to accomplish with menthol. And here's the conclusion we came to at that time. There was enough science to possibly act and ban menthol from cigarettes, but it wasn't real strong. Matter of fact, it was pretty weak. I think if that was our only choice, we could have gone forward with that, but it was really weak, and it was going to be a tough uphill fight to try to prove that menthol was actually responsible for anything that was not appropriate for protection of public health. In addition to that, the evidence I had at that time was that it wasn't going to have much public health impact. Sure, a lot of people smoked menthol, but they were just going to switch over. They're just going to switch to other cigarettes. And so it really wasn't going to have a whole lot. So you got something where the evidence is weak and not going to have big of impact. Then we're looking at nicotine. Nicotine has huge amounts of evidence. I mean, it's clear that nicotine is the most addictive substance in tobacco. The evidence was big. We did a research program, which is still going on, with the evidence is just mounted big and big. And the impact, we believe, with reducing nicotine is going to be hundreds of millions of lives saved. It's going to have a huge impact. Matter of fact, I believe it's going to be the death knell for the cigarette, or hopefully for all combusted tobacco products. And so, little evidence, not much effect. Huge evidence, huge effect. It really wasn't a hard thing to balance out. And so my recommendation very much was focus on nicotine, focus on getting that down. Even though the fight is going to be hard, menthol, if we can't get anything else done, we'll work on menthol. But in actuality, the evidence is not strong and the impact's not going to be strong. So that's kind of how we weighed those things out.
We're going to have to wrap it up soon, but I just wanted to follow up on one of the points you made, which is like no change in product is allowed until it's reviewed. And I guess some people, maybe from more of a social science communications perspective, would think that a change to the package is a change. And I've heard you talk about this before. Can you just explain where we stand legally with respect to considering changes in packaging to be a change to the product?
Okay, there's two. I would agree with you 100%. I completely agree with that. There's two things, just to make sure you understand the difference. Packaging and labeling are two very different things. Packaging is the box. Packaging is something you can give me the chemical formula for. So packaging is definitely a part of the product if it affects the nature of the product. So I gave the example we talked about last night about cardboard that actually leach chemicals into cigarettes. That packaging can be regulated. Labeling is a different thing. I still believe labeling makes it a new product, but so we took action, and we took action against products that had come out with new labeling and said this is a new product and they're not to be found substantial equivalents. Tobacco industry took us to court. We went to court, and the judge said, labeling does not make this a new product. That still doesn't make any sense to me. I mean, to me, the definition of a new product, if I've got a product called Marlboro, and now I've got a product called Colorado, that's a new product. But the judge said, no, that's not a new product. If it's got the same formulation, so if the stick and the package is the same, and I just stuck a different name on it, it's not a new product. Made no sense to me at all, but that's what the judge said. Unfortunately, we've got to do what the judge said and follow that law. But that was extremely frustrating to have that, because it still doesn't make any sense to me. I don't see how you can give something a new name and that not be a new product. But I'm not a lawyer,
So of course, science is just one input into the policy-making process. But this has been extremely helpful to hear from a science perspective how to make our research much more valuable and can really be useful for within the regulatory science decision-making venue. So thank you so much for laying it out so clearly, going through the 4 areas, and I think it's given us a lot of excitement for moving forward. So thank you very much.
Sure, I had to.